Our next award goes to the Neurosurgery Pediatric Paper of the Year. So I'd like to invite Dr. Diego Morales, who's going to present on lumbar CSF biomarkers on post-hemorrhagic hydrocephalus and a bunch of stuff that I didn't know existed.
Dr. Limbrick, the co-authors and myself would like to express gratitude to the CNS for this great recognition. I'm here to discuss our manuscript entitled Lumbar Cerebrospinal Fluid Biomarkers of Post-hemorrhagic Hydrocephalus of Prematurity. As many in this room likely know, intraventricular hemorrhage is the most frequent severe neurological complication of prematurity and is associated with post-hemorrhagic hydrocephalus up to half the time. PHH is a debilitating disease needing lifelong neurosurgical care and is fraught with cognitive and psychomotor disabilities. For a few years now, our lab has set out to explore the diagnostic ability of candidate CSF biomarkers of post-hemorrhagic hydrocephalus to complement current imaging modalities. Our previous results, primarily through the use of advanced methodologies like proteomics and conventional ones like ELISAs, have shown that total protein levels and a number of specific proteins may be associated with PHH. One pitfall in this line of research is a comparison of lumbar cerebrospinal fluid protein levels from controls with ventricular CSF protein levels in post-hemorrhagic hydrocephalus patients. As we continue our search for a complementary diagnostic marker, we were able to address this pitfall and the possible effect of any rostrocaudal gradients present in the CSF by acquiring IRB approval to analyze lumbar CSF collected for clinical reasons throughout 5 groups of interest. Control individuals had no known neurological insults. Intraventricular hemorrhages were graded according to Papilli's criteria and never went on to develop hydrocephalus. Our criteria for PHH, which has been validated by the Hydrocephalus Clinical Research Network, includes a frontal-occipital horn ratio of greater than 0.55, progressive increase in occipital frontal circumference, splaying of the sagittal suture greater than or equal to 2 millimeters in the mid-parietal region, and palpation of the anterior fontanelle above the level of the surrounding bone. We also included a group that showed ventricular enlargement without progressive hydrocephalus. In other words, ventricular megaly from cerebral malformation, arrested hydrocephalus, or other unidentifiable cause but did not develop macrocephaly nor require treatment. Lastly, we included lumbar punctures from hypoxic ischemic encephalopathy subjects. Total protein was estimated using the BCA assay, while commercially available ELISAs were used to measure the levels of 8 specific proteins of interest, including amyloid precursor protein and its cleaved products, cellular adhesion molecules, and taus. In order to test for an association of CSF proteins with PHH and alternate outcome categories, a one-way ANOVA was used, followed with a Bonferroni corrected threshold of 0.0055 for multiple comparisons. We then did a logistic regression using proteins that showed an association to examine their predictive ability. Our subject characteristics showed no differences among the first 4 groups for birth weight, post-menstrual age at birth, or sample. However, the ventricular enlargement without hydrocephalus and the HIE group were born heavier, older, and therefore went on to have older CSF samples. As expected, due to our criteria, post-hemorrhagic hydrocephalus group had the largest ventricles as determined by frontal-occipital horn ratio. Here are the results for the 8 proteins run across the 6 study groups. There's a lot of data, but I'd like to point out that the one-way ANOVA and the Bonferroni threshold resulted in 3 proteins and total protein being significantly higher in PHH than all others. Amyloid precursor protein, soluble amyloid precursor protein alpha, and L1-CAM met the corrected threshold for significance and were determined to be selective for PHH among these groups. After seeing an association between those 3 proteins and PHH, we generated a logistic plot. This plot shows the CSF soluble APP alpha levels of subjects with PHH versus all those without. The same analysis was done for APP and L1-CAM. A simple logistic regression determined the strength of prediction for PHH, and cut points were chosen based on combinations of sensitivity and specificity. Further analysis of the 3 cut points resulted in an odds ratio of 80 for APP, 200 for soluble APP alpha, and 68.75 for L1-CAM in predicting PHH. Our study had its limitations. There were no true control infants. Even those subjects with no known neurological injury were born prematurely and subject to the influence of other clinical factors such as infection, inflammation, long periods of ventilation. These could all potentially confound the results. Additionally, in utero or developmental events and pre- and perinatal complications could potentially influence CSF protein levels in these very preterm infants. The difference in birth weight and postmenstrual ages of the ventricular enlargement without hydrocephalus group and HIE group could present differences in protein levels. In conclusion, we were able to show that total protein, APP, soluble APP alpha, and L1-CAM were elevated in the lumbar punctures of untreated PHH patients. The three proteins also went on to demonstrate strong predictive ability, with soluble APP alpha demonstrating the strongest at an odds ratio of 200. During the developmental period, these proteins play critical roles. Their increase may provide novel insights into the pathophysiology of PHH. One common mechanism we can begin to investigate is ADAM10 and how it cleaves APP and L1-CAM. We'd like to acknowledge the families of these patients that contributed to this research, whom without their selflessness, this research wouldn't be possible. I'd also like to thank Dr. Dacey, the Department of Neurosurgery at Washington University in St. Louis, the Limbrick lab members, and the Hydrocephalus Clinical Research Network, and the CNS organizers for the opportunity to present these results. Thank you very much.